But since we started talking about drug tests, I want to introduce you to our next guest. His name is David Bell of USA Mobile Drug Testing. David and I have known each other for about 10 or 12 years, going at least one lifetime before this one, maybe two. And they run one of the largest drug testing companies in the United States. And he actually got some oil from us and ran tests on me and on some other people to see how our oil stacked up against others and whether our oil tests positive for an employer who's testing their employees. So let me turn it over to David to give you a little bit about drug testing in the workplace.
So thank you guys. As Art said, I'm the owner of USA Mobile Drug Testing. We're a nationwide on-site drug testing company. So most of you guys have had a job in your life. Yes, right? So you've been down to a Quest laboratory or a LabCorp and you've provided your drug testing sample and you got your job, hopefully, right? Well, what we do is we actually come on site to save time for those employers. And my reason for being here today is not only that I'm a friend of Art for a long time, but we're running into a lot of challenges from employers calling us saying, hey, I've got a truck driver who's failed his THC drug, his drug test for marijuana, and is claiming he's taken a CBD oil. This is happening in all 50 states, and as these guys have attested to, not all products are what they claim to be. We're seeing about 80% of the products in the market where employees are taking them thinking, hey, I'm safe, it's being sold at 7-Eleven, I'm picking this up locally at my vitamin discount store, and I'm now getting randomly drug tested, or I'm getting hired in a new place and I'm failing my drug tests. And at the end of the day, the employer doesn't care. It's your responsibility to know what you consume, and if you fail that drug test, that's on you. Especially if you're regulated by the DOT, it's a safety sensitive job. It's all on you, right? You have to go through a long process to get back to work. So a little bit frustrating. As Art said, we drug tested him. He's a regular user of this product that he's selling here. And under the workplace standard cutoff levels, he passed the drug test. So, there you go. There were no other drugs in his system either, by the way. We did a whole 10-panel test on it. So we also got a couple of volunteers that were willing to take a product who's never taken a CBD product, and we tested them before the drug test. We did both a screening test, which is legal in Florida and many states, and then we sent the second sample off to a laboratory, SAMHSA certified laboratory, a workplace testing standard. And that the individuals came up negative. Obviously, there was nothing in their system. They consumed the product 5 hours later, which is traditionally, if you'd smoke marijuana, within 5 hours it would show up in your urine. And they came up negative at that second test, and then again 24 hours later. I can tell you one of our franchisees in another state was at a bar on a Saturday. They're selling a CBD drink. They put CBD on it. She knew she was taking it, just curious how it would work. Goes to her lab, the next day, takes the test, fails the drug test. Takes the test on Monday, fails the drug test. So again, it's just a testament to what's out in the market and really understanding what you want to put in your body. And so it's just really interesting. 2 points that I think you guys might be interested in understanding, considering CBD could contain THC and how that can impact you personally. And one is the difference between smoking marijuana versus consuming it, right? Digesting it. Where CBD oil is traditionally consumed through an oil under your tongue, sublingual, and you're digesting it that way. Our bodies metabolize THC differently. So what's really strange and what people are seeing in Colorado and other states where they have a 5 nanogram level says you're impaired to drive. The challenge is if I smoke marijuana and I go have a sobriety test and I'm tested, I'm going to be greater than 5 nanograms pretty easily. So if I'm a daily consumer, I'm going to fail that regardless of whether I just consumed or not. If I'm eating an edible, which could also be in some of these products that contain a higher rate of THC than they claim, we metabolize that differently. So you may pass a road sobriety test because your level will be lower, but your intoxication's higher. So some of the effects that you're feeling, you're trying to look for a particular benefit of the CBD, could not be the CBD, it could be the THC content that you're actually feeling. Would you agree with that?
I agree.
So, so that's one side. And the other side is really, what are we doing here as a country and here in the state? Most of you guys are probably from Florida in regards to legalization of marijuana. You guys all know it's going to be on the ballot here in 2020. It's something that they're working on. Recently spent a few days in DC talking to some legislators about the States Act, which is a piece of legislation that's kind of being pushed through the House right now to allow the states to determine the legality of marijuana. Illinois became the 12th state, Hawaii the 13th state that recreational marijuana. A little bit different than Florida. We have a little bit different voters here than in those states. So the challenge is the legislation is pushing through laws before understanding the real impact, right? So as an individual who works in the drug testing industry, our concern is safety. So how many of you guys would be excited to know you get on your plane today to go home and that pilot has just got done smoking a joint? Show of hands, anybody? See nobody, okay. So on seriously though, would you like to know if he had consumed marijuana just before getting on the plane? Would that be something you could concern yourself with, potentially? So the point of that is really safety's the key, right? So when we talk to those legislators, it's not about whether we're for marijuana, against marijuana, for CBD, against that type of a product. It's safety's the concern, right? And so we're looking for legislation that's going to go along with alcohol's legal. We all consume alcohol, maybe I say all of us, but a lot of us consume alcohol, but you don't get in a tractor and drive your tractor if you've been drinking. So essentially that's what you're going to see a lot of the industry moving towards. People who are employers, people who we represent, that's what they're fighting for. They're fighting for an opportunity to be able to test, to rule out impairment, right? And so where there isn't currently a test that determines impairment with marijuana, you can't determine that you're impaired. I can't give you a breathalyzer test. It's different than alcohol. We metabolize it differently. So it is really open space. So as he mentioned, it's the wild, wild west. It truly is. And it's going to be very, very concerning if you are an employer, you employ safety sensitive individuals, on how you're going to manage that in your workplace. So I'll be around to ask questions later if you have any other questions about that. So Art?
Thank you very much.
Yeah, absolutely.